As we initiate chaos, theory guarantees that we'll play like lightning shots, sounding like thunder. For every time in the face that it hits us, we're faster. Well, they should know by now. They see the world keeps trying to shake us. It only wakes us. The pendulum swings. The pendulum swings. It's in a beautiful darkness. Napoleon another. It's full steam ahead. Full steam ahead. All about the Betty Express. Misdirected from the start. It's a runaway train. I come a freight train. I come a freight train. In a beautiful darkness, the Petty Express. In a beautiful darkness. Yay, whatever was wrong with StreamYard is fixed. It was saying high traffic, can't go live, wait 30 seconds and a minute. And granted, I probably didn't wait that because technology not working when I need it to is like one of my not things, but it all worked out. I refreshed the page and it seemed to work. We are going to pick up right at recross. So the Commonwealth has come back and I have made the executive decision. They covered nothing. They did nothing to rehabilitate her to the point that I think that they would have needed to. I mean, they probably would have had to involve, the Lord for resurrection and rehabilitation of, person of that proportion. But I do believe that, in watching some of the commentary from other creators, there's a bit more that Reddington gets out here on Recross, and then the next weekend, or not weekend, next witness, nurse practitioner, I think Paul, will be a bit of bit of fresh air for us because of all of sort of the, reading ahead that I've done. The general consensus about her is that had she been able to take care of the case, and been sort of the primary, mental health practitioner for Lindsay, we might not be here, was the general consensus. So it will be interesting to see if we find that. Now, just a little heads up, contemporaneously, like in the live trial, from what I've been watching along, up until I had to switch over to kind of come back in time with you guys, it does look like there was a hearing being held. The defense has contacted, if you've been on X, I cannot remember her name for the life of me, names escape me, but there was a nurse that worked at McLean Hospital, in the mental health unit. Now, I do not believe she was employed at the time of Lindsay being inpatient, but she, has come out and oh, Emily, thank you. Uh, she has come out to condemn, the hospital knowing that basically during holidays, these wings are basically, um skeleton crews. They are barely functional. Any effective or functional care is bare bones at the at the very best of days when you're on skeleton crews like this.
Infants hospital records from Rhode Island dealing with Lindsay Clancy.
No objection.
Okay, they may be admitted.
I just want to look at them at some point to make sure it's a clean copy.
Sure, yeah. Before it goes to the jury, you can review it.
And it's important for it's important for a patient to be forthright when asked questions by their provider, right?
Yes.
And you always, your opinion, found her to be forthright, right?
Yes.
If I could approach you with.
Thank you. I have to go to a fairly important appointment. So while I would much rather show up in Jedi robes, because they look super comfy but also authoritative, I've always been a big fan of a robed outfit, like a gown and a robe combo. It always looked scholarly, wizardly, and comfy all at the same time. If Dumbledore, what I am saying basically is if Dumbledore released a fashion line, I would be there in a heartbeat, in a heartbeat. So I am wearing an age appropriate and not themed dress. I will not be wearing the bow in my hair. Uh, but it is all in protest because I would much rather just dress up as a Jedi for the rest of my life. Um I'm okay trying to learn the whole YouTube thing. Now, uh this is a total aside, and I probably should have mentioned it on Mornings with Mo. But if you are at any way, thinking or considering doing YouTube, I know that coming in the new year, a lot of the standards to get monetized are going to change and revise to the older, higher numbers. So I kind of came in at the YouTube sweet spot where they had kind of lowered the requirement to 500 subscribers, where it is currently, along with a combination of watch hours and things to join the creator program. Um, but I do want you to be aware that going into the new year, it does look like YouTube is going to go back to the old kind of requirements. So 1,000 subscribers and more view hours. So if you are wondering about dabbling or dipping your toe in, I'm not sure, but this might be the time to do it, because it does look like they are revising those numbers upwards. Alrighty, let's get back to this. The record she never looked at, part 33.
Exhibit 220, excuse me. And see the second paragraph, it begins in the middle of November. Could you read that first sentence?
In the middle of November, she tried taking a marijuana edible to help her sleep, which caused her to have increased anxiety and palpitations.
So the records, if you had obtained them, you would have seen that it was not marijuana, it was not gummies, plural. It was one gummy that she tried and it didn't work out, right?
Well, but doesn't it say it was a marijuana gummy? I mean, or are we trying to talk about CBD oil versus Delta 8? My brain, because CBD oil, from my understanding, not being a doctorologist or Woody Harrelson, is that CBD oil has all of the sort of happy, druggy components of the THC removed and only leaves the components that are thought to be effective on pain relief and something else and other things. Uh, yeah, and you're not supposed to take the whole gummy, sweetheart. You quarter those. I mean, unless you are a frequent, unless you have been on the Pineapple Express before, if you don't take a full one.
Based on what I just read, yes.
Then you told us that there's a difference between a thought
No.
of suicide versus a plan of suicide, one of which would result, in your words, were a commitment, right?
Yes.
What does that mean? Thought versus plan equals commit.
A suicidal plan means that they are, they know exactly what they're going to do to end their life, what they're going to use, maybe when they're going to do it. They've researched it, and that presents an immediate threat, and that is something that.
Now, I do go back to what I shared this morning, that for people who are extremely logical, or you know what, screw it. For me, my cry for help, me reaching out for help, me being at my end of my rope is going to look like I'm just calling to make a doctor's appointment. Because all of the stress and anxiety, about, tempering my emotional expectation, trying to find a way that I can communicate my needs to the doctor. These are usually 2 to 3 week long, mental journeys I have gone on with myself because I know that if I don't have all of my ducks in a row, all of my things uniquely researched and advocate the hell for myself, there's a very likely chance that I am going to be ignored or looked at like a hysterical woman. So by the time I call you, that is me asking for help. A cry for help can be very subtle, and I get how hard and difficult that can be to read for a clinician. But I need you to understand that some cries for help might be subtle, but they are just as indicative of someone who is at the end of their ability to handle things on their own, and they are asking for help.
It would require hospitalization.
District Attorney had asked you also about the thyroid levels, and you indicated, or she indicated that they were in the low range at Mass General Hospital, Reed. Is that correct?
I thought she said they were normal.
Oh, I thought she said low, but normal or low. MGH, Mass General Hospital, right?
Sorry, what's the question?
District Attorney asked you whether or not they were thyroid reads. Do you remember that question?
She said her thyroid had been tested.
My question now is, do you remember that question that she asked you that you answered with no problem?
Yes.
Okay. And you're
Again, remind me what your job is. Is your job is to listen to people and not be thinking about what you're gonna say, because your job is uniquely dependent on your ability to observe, not insert yourself into the patient's inner monologue. I can see why she might no longer be a shining star in her profession after this trial.
Her response was that my memory, because jurors accounts, that it was low reads, MGH, and South Shore Hospital. Is that right?
I thought she said that it was normal or within normal limits.
Almost fine. We'll go with normal. So your memory is that there were thyroid blood level reads of Lindsay Clancy from 2 healthcare providers. Is that correct?
Yes.
One would be Mass General Hospital, right?
I don't remember exactly. I think she said yes. I think she said Mass General.
If you cannot pay attention and remember things from 30 minutes ago when you had all the confidence and, brass tits in the entire world to explainarate yourself and try to rehabilitate yourself, I'm going to need you to put your big girl voice on and have just as much ball sack as you had back in, redirect, ma'am. Put your big girl panties on. I'm gonna need you to stand by these BS choices that you made just as much as the rehabilitation that Broomhilda and Trunchbull over there decided to give you. You are dealing with a no-chill mo. Your indifference is the reason why people stop asking for help and just white knuckle it through life. And for a society that wants to talk about taking away the stigma of mental health, do you know what other thing stigmatizes it? When you go to a doctor and you get a cahoon like this.
Okay. Do you remember where the other hospital healthcare provider was?
It might have been South Shore.
Do you know what date those were?
No.
Those are old.
I cannot take credit for Trunchbull from Matilda. I believe that was a universally agreed upon likeness in one of the Commonwealth.
Weren't they?
I don't know.
One of the things that the district attorney asked you about on a number of occasions that seems to be important is if the person that you're treating has, I guess, what do they call it, pressured speech?
Yes.
And you told us repeatedly that you never detected that Lindsay had pressured speech, right?
Now, I need you guys to buckle up because this is masterful. And I don't think that her comeback is as masterful as his basic, did you complete your homework correctly? Did you use a number 2 pencil? Did you completely fill out the Scantron bubble? When you fail to do any of those basic things or add a comma, it doesn't bode well for you.
Correct.
I'm sorry?
Correct.
Looking at the record from October 21st, would you,
Objection is writing on this.
oh, all right, you know what, I'll ask you to.
Okay, Broom Helga.
Might take a look at it, and if you want to get the actual exhibit, we could do that.
All right, so,
Reddington's like, screw all that. Screw all that. I'm going to take this over here because it's her words that I'm arguing about. So we'll be just fine, your judgeship. He's like, that's okay, my Huckleberry. I got it.
forget all about my sloppy writing. I'm looking here on October 21st of 22. Is that correct, right up there?
Yes.
Okay.
Yes.
And can you just read this paragraph here for us?
No sleep last night. Falls asleep after 40 minutes. Heart racing, severe anxiety, worrying about kids, baby, sleep. Yawns, but not drowsy. Not hyper, pressured speech.
What was that? Not hyper what?
Not hyper, not pressured speech is what I meant. I know it doesn't say not, but that is.
Guess what? Guess what? Guess what? Guess what? It's the old axiom that I used, because you know what you meant to say is not going to help you, heifer. If I, myself, a lowly rehab pool attendant, was told, if you don't document it, it didn't happen. Cover your butt, cover your butt, cover your butt. Over document rather than under document, especially because we are seeing incredibly complex medical patients and we are a holistic clinic. So not only would my observations include, subjective, patient was able to tolerate, 12 bilateral flutter kicks, did complain of increased pain on forward extension after rep 7 of, set 3. We'll look at possibly increasing that goal in consultation with provider, that kind of thing. But also I would say patient observed to be in a relaxed mood, shoulders down, respirations normal. However, this would change when patient brought up spontaneously concerns about this, that, and the other. So while I was in more of a hybrid, very small private clinic where we did chart holistically, and you might not typically see affect and mood and situational things documented as such. That was the way I was trained. Now, I was trained by a very exacting nurse practitioner who knew, herself being a chronic pain patient with a severe spinal injury, exactly the kind of hell that most chronic pain patients go to before they reach a rehab center that will listen to them, that will treat them as a whole patient. Our intake history, we told our patients to block 3 hours. We did an in-depth range of motion. We did pictures. We did a gait assessment. And sometimes if the patient was in a flare or it was too bad, then we got them into the pool regardless so they could get some pain relief. So it could end up being a 5-hour-long appointment. And yeah, it ended up going out of business because insurance models aren't set up to really pay for the long-term kind of rehabilitative daily life care that chronic pain patients require to function. So I get that there is a business model disconnect. But when I tell you that I am flabbergasted at her documentation. I was a peon. I was a little cog in a machine at a tiny office. But if I I would have been fired from my little cog peon job if I turned in documentation like her.
Exactly what I meant.
When did you see this that you noticed that it did not say not?
I don't care what it says. I know what I meant.
That doesn't work. Do you wanna understand what you're looking at in the civil lawsuit, sweetheart? Because 'Cause I'm here to break it down to you. So what the first step of what is going to happen when, Reddington gets this suit, what he's going to do before he even takes the case is he's going to take all of Lindsay's files that he has. He's going to take them to an expert in the field of psychiatry with a subspecialty like you claimed, or a specialization like your marketing group claimed, in postpartum psychiatric assistance. That person is not going to talk to you. That person is not going to ask you questions. That person is going to make all of their decisions and give all of their recommendations as to your failures in standards of care based solely on your documentation. I need you to understand how incredibly screwed you are, because you're not going to be able to say, "No, I didn't mean that," until a deposition. That is after his expert has already torn you a new one, wrote a report, and is going to professionally eviscerate you on a level to which I don't think there is enough aloe or lidocaine possible to recover. If you didn't document it, much like in law, it did not happen. And documentation is important. Again, it is the only thing that stands for your care for another doctor. Other doctors are relying on your charting to make sure that they are, doing their own jobs. Her piss poor charting could have put the professional licenses of other doctors who are looking at her charting in order to make evaluations about Lindsay in professional jeopardy. This is not a, "Well, I made a little error." This is, again, this is how a patient is represented when they're not in the room.
Well, when you wrote this, you did not say not pressured speech. You said in the medical record, pressured speech, right?
No.
Does it say that?
Yeah, the word is the word not is right before not hyper comma pressured speech. The
Right, so
two
what
are
does
following the
comma mean
not.
to you? When you put down in a
The
medical
comma
record,
means a separation in what you were talking about, not pressured, comma, hyper speech. Don't get pedantic with someone uh, who loves to get into the mud in intricacies that would bother no one else.
heart racing, comma, severe anxiety, comma, worried about kids, comma, baby, comma, sleep, comma, yawns but not drowsy, period. Not hyper, comma, pressured speech. That's what you wrote, right?
She did not have
Did you
pressured
write that,
speech.
doctor?
I wrote that, but you're misinterpreting my note.
Am I reading this correctly, and the jury will be able to look at it, that you put not hyper, comma, pressured speech? Did I read that right?
Yes.
Just admit it, bitch. Just admit it. You're making it a bigger deal and you're looking like a moron. But hey, continue fighting on grammatical errors when in fact you look incompetent. Really, this is the hill to die on, bitch. It was a comma. It was an Oxford comma, actually. It's just an invisible ink. Sorry, you guys. Usually I am not I am not so daggone fired up. I usually don't curse as much in the first 20 minutes. Bye-bye monetization. But I am fired up. This snarky heifer cannot even admit to a grammatical error. She cannot humble herself to admit that she might not be omnipotent and all-knowing in all times when she has shown exactly no pattern in her professional behavior that would give her that delusional concept that she is at all perfect or the source of all knowledge. She in fact has been unique in her display of ignorance, masquerading as arrogance. But she wants to go over here and comma it out.
but your interpretation
The level to which I hope that the civil suit professionally is a live vivisection of your career without lidocaine. Again, professionally and and a critique of your experience. I would be like a Victorian in one of those studios where they did live vivisection. I don't recommend it. What the hell was wrong with the Victorians? Stop repressing everything. But professional live vivisection of you in the civil trial, I am willing to fly to Boston. I am going to need to start saving money, but I need to practice being quiet and not laughing, but I will be in co I wanna try to be in that court, at least for her, because I can death stare too. In fact, and I know how to be subtle, so can you imagine me in the courtroom when she's trying to explain the comma? Hmm. I have a little while to perfect all of my serious sarcasm faces, but I am on a mission and I am training heifer. See you there.
is incorrect.
It's incorrect.
As opposed to yours?
Reddington, just when I thought I couldn't love you, I love you more. Never gonna give you up. Never gonna say goodbye. Never gonna run around and desert you. Reddington, we love you.
Go ahead.
Just in regards to what was raised there.
Yes, just to brief.
No. No, I'm sorry, Broomhilda. Do, 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 do.
Right there, raise your right hand for the clerk.
Good afternoon. Do you solemnly swear that the testimony and the evidence you should give to the court and the jury in the matter now having
Basically, she was bitching that, he was misinterpreting the words that he was reading directly as written, um, which is an interesting hill to die on, but Harry, there you go. And I skipped over the Commonwealth. They were probably gonna say, "Did you mean to say she wasn't pressured speaking?" "Yes, but he's just reading my comma."
Thank you. You may have a seat.
Watch yourself, please.
Thank you.
All right, good afternoon.
Good afternoon.
All right. Yes, Attorney Buckingham, please.
Thank you. Good afternoon.
Good afternoon.
Could you please tell the jury your first and last name?
Julie Paul.
And
No, I really wanna pay attention to her because the general read on her has been, apart from looking like Leo from Charmed, and I'm sorry, it's just what my brain does. My brain cannot remember names, but it will pick an actress or actor that you look like and immediately pop up into my head, and if I'm not paying attention, it will pop out. So I apologize. She seems to be very credible, very confident, or competent, sorry, and confident, but also she seems like a practitioner that would not have failed to ask the questions. And it's really quite tragic that of all the people that we are going to meet in this trial who handled Lindsay's medical care, this was probably one of the briefest practitioners that was involved in her care. And she appears to be one of the most, competent.
what do you do for work?
I am a psychiatric mental health nurse practitioner, board certified.
And can you tell us a little bit about your educational background?
Sure. I graduated in 1991 from St. Anselm College with my nursing degree, worked as a labor and delivery nurse for 17 years, and then graduated in 2006 from Frontier Nursing University with my midwifery degree. And then in 2018, I graduated from Frontier Nursing University.
And this is the kind of doctor you want. A doctor who has a background in midwifery, who understands the unique hormonal toll. And I do think that there is a I'm gonna get on my soapbox here a little bit. As a mom of 6, I am the first to tell everyone that pregnancy is a natural, thing, and your body's gonna do a lot of weird things. But I do think there is a general kind of, I wanna say, glibness about the real kind of basic reality of the toll that is put on women's bodies both hormonally and just physiologically, with childbirth, and it is a normal thing. It is a wonderful thing, and most of the time, there aren't a lot of medical, complications, but it's incredibly taxing. Having done it 6 times, I can tell you there is no tired, like, first trimester tired, where your body is starting to ramp up blood production, your hormones are through the roof, your immune system is depressed, your whole body is ramping up to support creating a human being, and I sometimes think that because it is a natural process, we sometimes don't realize just how incredibly monumental all of these processes going on at once are on a woman's body, and because, maybe we women don't like to complain or we think it's just normal, so we haven't ever complained, but I can tell you having lived through it 6 times, it's exhausting, and I loved having all my kiddos. Please don't read this wrong, but with my youngest, most ferals, my body never had a chance to recover, especially between, middle, feral son and youngest feral son. There was only 8 months in between, me having middle feral and getting pregnant with youngest feral, and yes, I know there are personal choices that can forestall this. Uh, I get it. We were 2 weeks late on the vasectomy. Like, we had a plan. But I do think there's not enough, I do think there's not enough, reality or attention paid to just how incredibly hard on a body normal pregnancy is, just with all the normal stuff, with the changes, and, maybe because it's seen as a natural, happy thing, we don't always, talk about kind of all of the things that are going on and the not so great parts of pregnancy, how you kind of feel outside of your body and not control of it and different things. So that's my only thought and consideration.
with my psychiatric nurse practitioner degree. I also have a perinatal mental health certification from Postpartum Support International from 2018.
Okay, are you also a certified midwife?
Yes, I am.
And are you licensed in the state of Massachusetts to be a psychiatric nurse practitioner?
Yes, I am.
And what is required in order for you to become certified to be a psychiatric nurse practitioner in Massachusetts?
I attended a certified program, did 2 years additional training, and then took the certification exam through the ANCC.
And can you tell us a little bit about your work history?
Now, proudly interrupting our serious thought, um, I first need to show you this to understand the genius that J.K. Buck created. Now, I won't be able to play you very much of this. I recommend that if you are ever at any point in your life having a bad day, to simply go to your local YouTube screets and type in "taste the biscuit," and this lovely little gem will pop up. I can only play about a couple-ish seconds and then show you what J.K. Buck has created because I think this might be my favorite meme of all time.
Taste the honey sauce. Taste the goodness of the biscuit with the honey sauce. Don't get
Okay, I wish I could play you the whole song. I really do. But this is genius. J.K. Buck. This is gold. This is gold. I love it. Just for comparison again.
that honey sauce on me. I don't like the way it tastes with my chicken wings.
Okay. A. B. They're the same picture. I don't know what corporate's talking about. This is the same exact picture. I'm also waiting for them to be at a TJ Maxx near me. Taste the biscuit, taste the honey glazed ham, or whatever. Okay, let's get back to the trial. But I had to share that with you, um, you all.
Work background?
Sure. Like I said, in New Hampshire, I worked as a labor and delivery nurse before transferring to Massachusetts in 2006 to work as a certified nurse midwife. And then in 2018, I started the perinatal behavioral health program at South Shore Hospital as a psychiatric nurse practitioner.
And so the perinatal behavioral health clinic, explain to us a little bit about how that came about.
Sure. There's a lack of resources on the South Shore for pregnant and postpartum people with mood disorders. So I really felt compelled because I had a couple clients that really struggled with mental health issues as a nurse midwife and really wanted additional education and
Ma'am, can you adopt me? You looked around all of New Hampshire and you were like, "I need to help the pregnant broads." And you're like, "You know what? I'm a broad. I can do this." And you just did. Imagine. Imagine someone not coming in saying they're an expert and looks around and sees a need in her community and says, "Oh, you know what? Maybe someone should do something, and I have training and expertise."
being able to prescribe for them and take care of them in a proper way. So I went back, got my Psych NP, and then worked with South Shore Hospital to establish the program.
And where was the program actually located?
It was located right in Weymouth, Massachusetts.
And you said you worked with the South Shore Hospital?
Correct.
So the clinic is tied to South Shore Hospital in the South Shore Health System?
Yes, it is.
Now, when did you start that program specifically? When was it up and running?
2018 is when I started, in October of 2018.
Okay. And what, did you do that by yourself, or did you have other practitioners that were doing that with you?
Initially, it was just me. I started doing it 2 days a week and then grew the program gradually over the next year or two.
And what makes up this program other than you?
So at the time, when it was just me, I just saw patients 2 days a week and then gradually built up to 5 days a week. And we included a therapist in the team, 2 additional prescribers. We also worked with women with substance use disorders as well. So we had additional support that way. And then when the building grew, we also had the Bridge Clinic on the other side. And then we were on the other side of that program.
And what's the Bridge Clinic?
The Bridge Clinic works with people with substance use disorders.
And all of this is kind of under that umbrella of what's classified as South Shore Behavioral Health, correct?
That's correct.
Now, as the clinic grew, did your role there change?
I'm sorry, can you repeat that?
As the clinic grew to what you described as having additional therapists and other prescribers on staff, did your role there change at all?
I became the director of the program.
And as director of the program, did you still see patients?
Yes, I did.
And was that at the same level as it had before, or did it decrease because of your administrative roles?
It actually increased because I increased my hours to 5 days a week. I did have a little bit of administrative time.
Okay. And can you tell us a little bit about how the clinic would work for a woman who is coming in either during the birth period or prior to birth and after birth? What kinds of things would they be offered at the clinic?
So I'd receive a referral and then the client would come in. We would do a 90-minute intake. When they left, when it was just me, I was using outside therapists, that sort of thing. But as the program grew, we had moms groups run by doulas. We had therapists that was brought in from Aspire, but part of our program embedded within our program. And I brought in 2 additional prescribers as well as nursing staff.
And when you talk about people as prescribers and your role as a psychiatric nurse practitioner who could prescribe, what were you offering to patients as part of this clinic as a prescriber?
We were offering the proper medication for anxiety, depression, mood disorders, really any psychiatric disorder that came in, mostly for pregnant and postpartum people up to 2 years postpartum. We also offered like therapy.
Given that answer, I really hope that the defense picked up on that. Now, Mr. Reddington appears to be a steel trap, but the fact that she has pushed out the postpartum period to 2 years, I wanna know why. First of all, that just strikes me as interesting because it's so much longer than even the 1-year period that we've heard from the either it's the CDC or the WHO, I couldn't remember who cited, um, in the past testimony. But, what what in her understanding as a professional, has caused her to push that postpartum period in her practice or the practice that she was, you know, making, or establishing, why does she put that postpartum period up to 2 years? Because I think that's going to be very interesting. Um, as a juror, I already find her competent and, believable, but that would be something that would immediately pique my interest, as a listener, as you can obviously tell it did me, because this is, honest to goodness, one of the very first competent mental health witnesses we've had on. I find her to be trustworthy, honest, and okay, I'm just gonna say it so my brain will stop saying it to me. She has a remarkable resemblance to, my Uncle Doug, and I mean that with no great I mean that with love because I love my Uncle Doug, but, okay, there it is. She's remarkably competent, and she reminds me of a loved one. Now, brain, shut up about it and listen to the smart. You have had your say. I have said it out loud. Now shut up. Welcome to Mo's Mental Health Talk with the Council of Mo's on live stream.
Focused on sleep hygiene, really looked at the whole person, not just medication management.
And fair to say that the medication is one piece and the therapy is another piece, and this is part of a team approach that you had at the clinic.
That's
to
correct.
Address all these resources for patients.
That's correct.
So while you, as the psychiatric nurse practitioner, might have been a prescriber, were you also engaged in the therapy or psychotherapy?
I would do supportive therapy, but I'm not a therapist. I mainly am responsible for assessing, diagnosing, prescribing, but I also really understand the importance of sleep, nutrition, and exercise.
Why? Why couldn't Lindsay have gone to this woman? I I wish I could be lighthearted, but I'm simultaneously gobsmacked and heartbroken that had Lindsay potentially, and I know it's armchair quarterbacking, and I'm only basing this on what I see on stand, and she might just testify well. But the fact that her clinic looked at it, the holistic person, not just the pills they were throwing at them, you know, thought of them as a person. I did a lot of research before I found an evaluation site I wanted my doctor to refer me to. I looked for, I mean, now I'm kinda terrified, because of this trial, but I looked for an evaluation site and evaluators, that were, specialized in, diagnosing or evaluating adults, women, and, with a history of anxiety and other kind of diagnoses that didn't quite fit. I did my research, and my heart breaks because Lindsay probably did too, and that advertising, that thought that she was going to an expert, again, Lindsay's hands did it, but did those hands start moving because she went to see Dr. Jennifer Tufts instead of being recommended to go to this particular clinic?
And so, being that you had a history of working as a midwife and working as a nurse in labor and delivery, do you have a lot of experience with moms or women who are in that postpartum period?
Yes.
And how about your experiences with diagnosing and prescribing for women in that period? Do you have experience in that?
In the labor and delivery room, as a nurse midwife, yes, I diagnosed like labor and that sort of thing, and even depression, anxiety, not to the extent of higher acuity psychiatric conditions, but as a psychiatric nurse practitioner, I did.
Okay. And as far as your role at the perinatal behavioral health clinic, fair to say that your primary patient base was all going to be women who are either pregnant or after birth?
Correct.
And a part of this team approach at the clinic, is it also to work on developing a treatment plan for patients when they come in?
Correct.
And so what encompasses a treatment plan generally?
Generally, if it were a situation where we were referring them for therapy, then we would work with the therapist to kind of bring in the client to figure out what their needs are, and then really stress whatever. The therapist works on certain aspects of the therapy that we kind of work together, but not in tandem, kind of. We talk, but not to the extent we each are in our own disciplines.
Okay. And as far as the resources that the clinic had available to you, is it fair to say that there are certain types of therapy, for instance, cognitive behavioral therapy or dialectic behavioral therapy, that are not necessarily encompassed with the social workers that you work with at the clinic?
Our social workers primarily did cognitive behavioral therapy. We did group therapy for more social support. What I did mainly was just supportive therapy.
Okay. And would you oftentimes through the clinic refer clients out to other local community providers?
Yes, we would.
Now, as the psychiatric nurse practitioner, does medication play an important role when you are dealing with a particular patient that came into the clinic?
Yes, it does play a role.
And how is it that you determine what's the appropriate medication track for any given patient?
We do proper screening, and then we do a complete interview with the client. And then based on what their responses are, together we work as a team to develop.
Wait a minute. Slow down. Because I was reliably told all you need was a television and 30 minutes and an overwhelming, overarching, and unearned thought that you are absolutely correct. And you too could diagnose. Wait, you mean you talk to the patient? You get their history? I mean, it's a bold strategy, Cotton. I ain't heard of it yet in this trial, but you might be the one that starts a trend. She's gonna make Fleek happen.
The best medication options or treatment options for that client.
When you say work as a team, does that include the patient themselves?
Absolutely. The patient is the most important part of the team.
Jen the Couch Fairy, I believe if this is the medical provider that I'm thinking of, she was seen in transition. I believe she was moving on in her career. And then I think nurse practitioner Gelada then took over. But I do believe that she might have initially seen Lindsay and questioned some of the medication or asked some questions. She might have even done, part of the intake or, her clinic might have. But I think this would be the one where they determined she was not a good fit and sent her home after one day, if I'm remembering things kind of in the correct order.
And
Yes,
in
this is
your
the good
training and
doc.
experience working with postpartum women, what is the acceptable period to determine postpartum?
Anywhere within the first year.
Did you know a nurse, or do you know a nurse named Susan Clancy?
I do.
How do you know her?
I worked with her off and on throughout my years as a nurse midwife.
And what's the nature of your relationship with her, other than the working with her?
Essentially, we just worked together. When we did births together, we worked well as a team.
Okay.
This woman has a lot of associates. She maybe has a small group of friends. I'm maybe female, but they're not going to be the typical, she's not going to be the office chatter or gossiper. She's there to do a job. It requires peopling to some extent, but she's there to do a job. So I wouldn't imagine she would have like work besties or anything like that, just based on observations I am making. Uh, she seems very detail focused oriented. She kind of reminds me of me when I'm on a mission. So I'm not there to be friends. I'm not there to, if I'm in the middle of something, I'm not there to be social. I'm there to do something, and I would rather you not talk to me so I can get it done and then go back to my house. Why did it take me so long to consider that I might be on the spectrum? Anywho, soul. Snipe. Look, I am already telling. Look, don't do that to me. I already told you she reminds me of my uncle, and especially that face, and I'm trying to be the nice person because she is a competent doctor who seems to care about her patients, and all my brain keeps telling me is, "That's your uncle. That's your uncle." And I'm like, "Would you shut up, brain? She's saying smart, competent, compassionate things." My brain is like, "Nerp. Gonna keep reminding you of it." Thank you.
And do you know where she worked?
She worked at South Shore Hospital.
On November 20th of 2022, did you have a conversation or did you get a call from Sue Clancy?
I did. She was referred to me through Nanette Landry, another midwife that I work with.
Okay. And so as a result of the phone call that you had with her, did you get in contact with a woman by the name of Lindsay Clancy?
Yes, I did.
Was that the same day or a different day?
It was the same day.
And your contact with Lindsay Clancy, was it by phone or virtual or in person?
It was by phone.
And so what was the purpose of calling Lindsay Clancy?
I just wanted to get her side of what had been going on with her history. Sue had alluded that she was struggling in the postpartum period, so I wanted to know exactly what she was struggling with to see if she'd be a good candidate for our program.
So did you initiate the call to Lindsay Clancy?
With the permission, I asked Sue Clancy if Lindsay had given permission, and she said she had.
Okay. And in the conversation that you had with her, do you know approximately how long that phone conversation lasted?
I don't recall.
Okay. But were you able to get all the pertinent information from her during that phone call?
I got enough data to determine that she would be a good candidate for the program.
So she would have met criteria for a referral from any other resource?
Correct.
Now, is it fair to say that in this conversation, in order to determine whether she qualified, you had to ask her some background questions?
I did.
And so were you able to identify whether she was in that postpartum period?
Yes, I asked when the birth of Callan was, and she said it was May 26th, 2022.
Sorry. And so after determining that she was in fact postpartum with a baby at home, did you ask her any questions or did you learn any information about how the experience was earlier in the postpartum, right after birth?
I did. She said she did really well for the first 12 weeks. She was excited, really happy. And then when Patrick went back to work, she said she started to struggle with some anxiety.
And you knew Patrick to be her husband, Patrick Clancy?
Correct.
And do you recall her indicating that she was having difficulty leaving the baby, that she was feeling overwhelmed and having racing thoughts?
Yes.
Okay. And so in your training and experience, are those things that you would hear from new moms?
It was very typical of what I'd hear.
Did you learn from her whether she had engaged with any other treatment prior to contacting or prior to you having this conversation with her?
She did say that she had met with a psychiatrist. She didn't give the name. And then she'd also said that she had been in the emergency room a few days prior to.
Okay. And were you able to determine that was actually the South Shore emergency room?
Yes, it was.
And that would have been on November 16th of 2022?
Correct.
Now, in addition to seeing a psychiatrist, did she identify to you some...
All right. In behind the scenes, I will be stopping at probably 12:30. In behind the scenes news, my brain has worked it out. And again, I apologize profusely, but I feel Look, I have the uncontrollable desire to prove that I am right about this, and I think I have found a perfect match. Um, about who she reminds me of, and I think JKD Buck and I agree, though we personally both feel like we are terrible humans after this. But behold, we have found her doppelganger. Uh The guy that plays Rupert from Ted Lasso, though she looks more like him in his Buffy years when he played, I wanna call him Rupert again, um, but you guys, this is why I cannot be in an office, this is why I cannot people, because I am always like, "You know who that person's face reminds me of?" And it can be quite terrible when you try to actually, pretend to be a professional or functional as a human in conversation. It can be what we like to call distracting. Okay, why are we what in the world? Alright, let's get back to the Clancy trial now that I've completely and thoroughly derailed as per usual. It is my raison d'être. Alright, let's get back now that I've sidetracked, sufficiently.
And what's the nature of your relationship with her, other than the working with her?
Essentially, we just worked together.
You know what? She does really, but I didn't wanna say that because I didn't want to compare her to anyone that I greatly respect, and, you know, I there are these little human moments that you get to see in trial, and as much as I hate, court TV and law and crime's desire to, always vulture watch the family, there were some really, really sweet moments, uh where you saw Katie soften and lean on her husband, and, uh, those were really sweet moments. You can tell how much this has cost her to be kind of the lioness and the mama bear for the entire Richens family, and it was nice to see that, she could lean on her husband because just observing her, she's had to kind of take on this persona as, the lioness, the mama bear, the warrior, and it was nice to kind of see her lay that down for a minute and be able to lean on her husband. It kind of reminded me of me and Mr. Mo. So as much as I hate, doing that, I think that it really softened her for me, and I shouldn't require anything, but I think it really humanized, and I was really happy that she had that support, because, you always wonder if these families have the support and care that you hope they do, and it was nice seeing them being able to offer comfort to each other.
That we worked, when we did births together, we worked well as a team.
Okay. And do you know where she worked?
She worked at Telshire Hospital.
On November 20th of 2022, did you have a conversation or did you get a call from Sue Clancy?
I did. She was referred to me through Nanette Landry, another midwife that I work with.
Okay. And so as a result of the phone call that you had with her, did you get in contact with a woman by the name of Lindsay Clancy?
Yes, I did.
Was that the same day or a different day?
It was the same day.
And your contact with Lindsay Clancy, was it by phone or virtual or in person?
It was by phone.
And so what was the purpose of calling Lindsay Clancy?
I just wanted to get her side of what had been going on with her history. Sue had alluded that she was struggling in the postpartum period, so I wanted to know exactly what she was struggling with to see if she'd be a good candidate for our program.
So did you initiate the call to Lindsay Clancy?
With the permission, I asked Sue Clancy if Lindsay had given permission. She said she had.
And in the conversation that you had with her, do you know approximately how long that phone conversation lasted?
I don't recall.
Okay. Okay. But were you able to get all the pertinent information from her during that phone call?
I got enough data to determine that she would be a good candidate for the program.
So she would have met criteria for a referral from any other resource.
Correct.
Now, is it fair to say that in this conversation, in order to determine whether she qualified, you had to ask her some background questions?
I did.
And so were you able to identify whether she was in that postpartum period?
Yes, I asked when the birth of Callan was, and she said it was May 26th, 2022.
And so after determining that she was in fact postpartum with a baby at home, did you ask her any questions, or did you learn any information about how the experience was?
I've asked it before and I'll ask it again. Was the Commonwealth fully downloaded from its Borg, assimilation? The way she asks these questions, I am doing what I have got the so you determined she was postpartum? Yes, she'd had the baby 3 months ago. That's well within the 1-year period. So you determined she'd had a baby. Yes, that's possibly the only reason she would be contacting a postpartum psychiatric, mental health specialist. So, so she had a baby at home, correct? Yet again, I answer with the same statement I did before. Yes, I am a, postnatal, postpartum, or I am specialized only in, pregnant and postpartum women. So if she were calling me because she had hysterical uterus, I would be confused. Yes, I think the Marleys were dead to begin with. I think we can assume that she's here for postpartum help. Dear God, move on.
Earlier in the postpartum, right after birth?
I did. She said she did really well for the first 12 weeks. She was excited, really happy. And then when Patrick went back to work, she said she started to struggle with some anxiety.
And you knew Patrick to be her husband, Patrick Clancy?
Correct.
And do you recall her indicating that she was having difficulty leaving the baby, that she was feeling overwhelmed and having racing thoughts?
Yes.
Pause. Okay, Commonwealth. You just said that sentence out loud. And you had a professional back you up and crediting that. How did you get she was a manipulative woman that hated her children and wanted out? The only time, again, based on everything you have presented in your case in chief, the times where Lindsay in her previous postpartum and in this particular incident in particular, the only time she seemed to show an increase of actual noticeable symptomology was when she was going to be removed from her children, i.e. going back to work. So how do you take all of those disparate facts and make it she hated her kids, she, didn't like them, and, then she was, tired, she wanted to pull a Letitia Stalk, so how?
And so in your training and experience, are those things that you would hear from new moms?
I believe she is going to, just kind of give because, again, if I'm placing her right on the treatment timeline, this was the sort of semi-inpatient, therapy program, that was supposed to be like a 8-hour-long program with a bunch of different things for postpartum mothers. They did their assessment. She went one day, and then they said that she wasn't the right, fit for the program, but, I believe that this particular psychiatrist had stayed on, and then her care was handed to, nurse practitioner, Joliet. So it's all still a bit nebulous to me, how and where in the timeline. And but she is one of the very first competent, mental health care professionals we've seen who seems to understand that patient care is more than looking at What pills can I prescribe you? She talked about sleep hygiene. She talked about nutrition and exercise and looking at the whole patient and being part of a group. Her specialty, gives her kind of understanding in the medical and medicine prescription side, but she also works in tandem with therapists, but she doesn't micromanage. So there is that heartbreaking realization that had Lindsay probably gotten primary mental health care from this particular practitioner, there's a possibility we wouldn't be sitting here. And I say that with a profound sadness and a great respect and admiration for this practitioner, looking around in her community, seeing a need that, postpartum and pregnant women were struggling with mental health and trying to create a clinic. So we've made step forward, but it's still profoundly sad that had she maybe seen the right practitioner, we wouldn't be here.
It was very typical of what I'd hear.
Did you learn from her whether she had engaged with any other treatment prior to contacting or prior to you having this conversation with her?
She did say that she had met with a psychiatrist. She didn't give the name. And then she'd also said that she had been in the emergency room a few days prior to.
Okay. And were you able to determine that was actually the South Shore emergency room?
Yes, it was.
And that would have been on November 16th of 2022?
Correct.
Now, in addition to seeing a psychiatrist, did she identify to you some medications that she had been taking up to that point?
She did. She said she had trialed Zoloft for 1 week. She also said that she'd been trialing Ativan and Benadryl, which worked the best to help her sleep. She identified she had questions about Buspar, didn't say specifically whether she had been prescribed that or not, but that she had questions about Buspar.
Okay. And did she mention anything about that combination of Ativan and Benadryl in her treatment history that was of concern to her?
Just that she had been taking it for 2 weeks. It worked really well, but then she was getting concerned about dependence, so she weaned herself off of that.
And were you aware, did she tell you that she had been prescribed trazodone after that?
Yes, after she went to the emergency room, she was prescribed trazodone.
Did she indicate whether the trazodone gave her any relief to her sleep issues?
She said she was able to fall asleep, but it was having difficulty staying asleep.
Did she also indicate to you that one of her goals was not to be on long-term medications?
Yes, she did.
And based on this initial phone conversation, did you recommend that she come in for an intake appointment?
I did.
Okay. How about the immediate need for sleep? Did you address that with her in the phone
I just encouraged her to take the medication that she already had on hand, that if the Benadryl and the Ativan were working, she should take that to help her sleep that night. And we talked the next morning about different options.
And also in this initial phone call, did you have a conversation with her about options and risks of various types of SSRIs or continued use of benzodiazepines?
Yes, we reviewed that being on SSRI most of the time is preferable than being on benzodiazepines for long periods of time, especially to address her concern about addiction or dependency on the medication.
Okay. And is this kind of a normal conversation you would have with somebody to screen them and determine whether the clinic, the South Shore Perinatal Clinic, was an appropriate fit?
Yes, it's more to establish rapport and get a basic understanding and make sure that she was safe.
Okay.
And she did indicate that she was safe.
And so that's kind of my follow-up to that. So in the course of that phone call, you were able to communicate with her, correct?
Correct.
And what she was telling you about her reported history, did that seem to make sense to you?
Yes, it did.
And did you identify, or were you addressing or assessing during the whole course of this conversation whether there was any immediate safety risk or need for her?
Yes, I was.
And did you find that there was any?
There was no immediate need.
Now, as a result of this conversation, did you determine whether she was having any suicidal ideations?
Yes, I asked her specifically if she felt like she wanted to harm herself or her children, and she said no.
And how about asking her about homicidal ideations?
Yes.
And did she indicate whether she had any?
She did not.
Did you also ask her whether she had experienced any auditory hallucinations?
I did.
And did she experience any?
Not at the time, no.
And did she indicate to you whether she'd ever experienced any?
No,
How about visual hallucinations? Did you ask her about those?
I did.
And did she indicate that she had experienced any?
No,
And delusions, did you ask her whether she had any delusions?
I didn't ask specifically about delusions, I believe.
Okay. And in the course of talking with an individual, do you kind of constantly keep that in mind with what they're telling you, whether they're having any ideas or of delusion?
Yes, I do.
In the conversation you had with her on November 20th, did you identify, based on your conversation with her, whether she was experiencing delusions?
No, I did not.
And fair to say, a standard set of questions that you also ask have to do with drug use or tobacco or alcohol. Did you ask those questions as well?
I don't recall.
And I like how she's just like, I don't recall, because you know what? She probably has, if she's anything like me. You get a routine in your charting, you get a system, so you'll establish a rapport, you'll get the kind of basic historical information. Then you would ask if they had any struggles. So I'm guessing that she has all of this documented, and she's a-okay with, hey, I don't remember specifically, if I could look at my notes.
If I were to show you your note, would that refresh your memory?
I have my notes right here. I could look at it.
Okay. I'm going to draw your attention to the note from November 20th of 2022.
Yes, I did ask her apparently. And she said no to illicit drug use, tobacco or marijuana or alcohol at that time.
Okay. And she also indicated to you that at this time on November 20th that she had stopped breastfeeding.
That's correct.
Now, did she schedule, or did you schedule with her an intake for the next day, November 21st?
We did.
And at the clinic, what generally is the practice for whether a person appears in person or on a telehealth visit or virtually?
Generally speaking, we like to do the intake in person as long as it's feasible. And for her, it was.
Okay. And just kind of while we're on that topic, going forward with a patient who's being seen at the clinic, what are the criteria to determine an in-person visit or a telehealth visit?
They're given the option about what works best for them.
And are there instances where you as a provider might insist a person comes in person?
If somebody needs to do like a urine drug screen or laboratory work, we'll have them come in. Or if they seem to be not
Yeah, telehealth does have its limitations. How are you going to pop hot on a screen test from your home?
making sense or having more difficulties, we'll have them come in person.
And if a person is scheduled for an in-person visit and there are no observed issues on your end, can they opt to change it to a virtual appointment at any point?
Yes.
And that's just the normal course of business at the clinic?
Correct.
Now, in this particular instance, you said the intake was in person, right?
Yes.
And during the course of the intake, are there particular types of questions that are asked?
I think I'm guessing they gave her the NBRA postpartum depression scale, the actual, kind of clinically sculpted postpartum scale. And I'm guessing there are questions on there about auditory hallucinations or visual hallucinations on that screener test. So that, and she might have also talked to her about, these specific concerns, given kind of maybe, noticing that her affect, Lindsay was saying, I am fine, but she was sounding like that. That might be something that she, as a practitioner, is going to say, okay, you're saying you're fine, but you seem very depressed. Are you often feeling very tired? How does what you are feeling like right now feel like to you in your best words? Because there is a kind of disconnect for some people that I wasn't aware of, where, it takes longer for us to figure out what our feelings are and process them. So if you ask me right after something happens, um, I'm going to say I'm feeling fine, whereas 3 days later when my body's, processed everything, I might feel devastated, um, because it's finally hit me. So there are a lot of things that you do as a clinician in mental health need to be intaking, and a lot of it is, comes from experience, comes from, you know, working in the field. So, for those who think that we are being too mean to Dr. Jennifer Tufts and we were attacking on her youth, no, we understood her youth. What we were attacking is her arrogance and the fact that if she felt that this patient was deteriorating, why she didn't lower herself or ask for a mentor's help. She seemed bound and determined to make sure that her own clinical analysis was the correct one by up to and including failing to write down anything as having any relation to postpartum time period. She had generalized anxiety with, attachment disorder, I think, or something like that, and, depression and anxiety disorder, but none of that was put in the, specificity of her being in this very clinically important postpartum time.
Of the person to get to know them and get to know their situation.
Yes, generally we do a full intake. The first thing they do is meet with the nurse who does all the screenings.
And one of the things that is asked of an individual when they come in is to tell you why they are there, right?
Correct.
What their complaint is.
Yes.
And so for this patient, for Lindsay Clancy, what did she identify as the reason for the visit?
Would it be okay if I refer to my note?
Sure.
So she said pretty much I cannot sleep was her major concern.
And is that something that you've seen in your experience with new moms that come through the clinic and are postpartum?
It's very typical.
Now, even with that report or that reason, do you do a full history to try to identify kind of what's going on in the
Again, where did you stop in your download of the Borg? Uh, So even though she said she was there because she was a little bit sleepy, did you go ahead and take the time to actually talk to her? I mean, she already told you on the little form why she was there, so I don't know why you would talk to her. Is there a fundamental, like, disconnect between reality and them? I am only somewhat joking. The only way my brain can translate this is that they skipped their download from the Borg.
present and what has happened in the past?
Yes, I do.
And generally, is it fair to say that that's kind of the goal of an intake, right?
I do that with every client. I have a standard set of questions.
Is that just for the intake or any follow-up?
Any follow-up, I have a basic kind of script, but I always adjust it based on what they're saying.
My sister in scripts, as a fellow script maker, because it makes peopling easier. Yes, I do have, I have a couple different scripts. I'm flexible. I'm not rigid in my adherence to scripts, but typically, um, if I'm talking to you, I've already scripted out our conversation at least 17 times and do have alternate conversation topics and like a possible fake my own death scenario in there in case I socially screw up.
But fair to say, once a person gives kind of that history of their background, especially if they've had prior births before, prior experiences with mental health professionals or psychiatric history, that kind of follows the patient as they go through with their subsequent visits.
Yes.
So in this instance, you had some background information from the phone call you had with her, but did you go back through those standard questions that you'd ask in an intake?
I did.
And did you learn a little bit more about about her current mental status? Did you ask her some questions about currently how she was in this November 21st meeting?
I did.
And so, again, do you kind of go through in each and every instance whether the person has any thoughts of suicide or harming themselves or others?
At every visit, those are standard questions that I ask if they have any type of suicidal, homicidal ideation or auditory or visual hallucinations.
Do you ask the same questions each time, or is it kind of fluid based on your rapport and conversation with the patient?
Generally, I try and touch upon the topic. Sometimes we get to that answer indirectly just by the line of questioning that we're using.
Okay. And where it had been reported to you that she had been on the Zoloft and stopped due to insomnia, that she was overwhelmed and her mind was racing, did you talk with her about intrusive thoughts?
I did.
And did she indicate whether at that point she was having any intrusive thoughts of harming herself or her babies?
She was not.
Did she report to you how she was feeling at home with having now 3 children to take care of?
She was feeling overwhelmed.
And that, again, reiterating that around 12 weeks when Patrick went back to work, that she was having increased anxiety.
Correct.
And did she indicate to you that that was something that she had experienced to some extent with her other 2 children?
At least with her second pregnancy.
And was she able to manage that with her second pregnancy without medication?
As far as what I was told, yes.
And fair to say she indicated that she would use breathing, meditation, and yoga to work through it.
Correct.
And so on this November 21st intake date, you again ask about drug use, right?
Correct.
And at this point, she had told you that she did trial one CBD gummy at some point, but that did not help.
Oh, hell to the no. Objection from the court of public opinion. A CBD gummy is not a reefer madness gummy. Now, I could be dead wrong in this, but again, the way I understood CBD is that they take all the fun stuff that lets you taste colors, and it is only supposed to have the positive, relaxing, calming, or pain relief side effects. So now we're going reefer madness with one gummy? She's a liar. No, besides, do we really want to talk about how many of the boomers are constantly high now? I mean, the country is basically self-medicated to the point of being a Pineapple Express movie because of, everything. So the Commonwealth is really picking the wrong things to harp on. The societal stigma of alternative pain relief or alternative medicine is not the same because we have an aging population that is coming to the realization that unless you want to be hooked to narcotics, what Western medical science has as far as pain relief and that will allow you to function in life without being a zombie is quite limited. So this is not the 1930s where reefer madness might have worked. And she took one, not, went to Lollapalooza to hang out with Willie Nelson.
Correct.
And you also learn about any prior psychiatric medication she had been on?
Yes, she had been on the Zoloft, the Ativan. She had been prescribed Buspar, but she didn't indicate whether she had taken that or not.
Okay, and so that was a report of her most recent course of treatment, but did she talk about having anxiety issues
yes.
further back in her history?
Yes, in college she had trialed Prozac, propranolol, and Wellbutrin.
And fair to say she indicated that to you that she did well on those medications in nursing school?
Correct, with the only side effect being sexual side effects.
Did you talk to her at this point in November 21, 2022, about whether she had a plan to go back to work?
I don't know if that was a specific day. I know that we talked about work at a different date.
Okay. If you have your note in front of you, I just draw your attention to maybe the last paragraph of the history of present illness.
Oh, I'm sorry. And you're talking about the day of the intake?
Yes, sorry.
Sorry, I thought you said the 22nd. So yeah, she had planned to go back to work in October, but it got delayed. She pushed it forward to November because she was having anxiety.
Okay. And during the course of this intake, again, you did those same mental status screens for any concerns, right?
Correct.
Did you know any in this face-to-face in-person meeting with her?
No, she was goal-directed linear. She was a great historian. actively participated in the care plan.
And as far as some of the screenings that you do during these visits, for a person who is in that postpartum period, are there any specific screenings that you do?
Yes, we do the Edinburgh Postnatal Depression Scale. We did the GAD, which is the Generalized Anxiety Depression Scale. We did the Mood Disorders Questionnaire Scale, the Colombian Suicidal Scale, as well as the 5Ps, which assesses for substance use disorders in pregnancy and postpartum.
And so as far as in each one of those screens, what did you find as it pertained to this particular patient?
She was significantly high in the GAD-7, which is for generalized anxiety. She scored 21 out of 21, which is, they're just screening, so it's not diagnostic, but it did indicate that she was experiencing extreme anxiety. And then with the Edinburgh Postnatal Depression Scale, she scored a 23 out of 30. But the one that I look for the most in that scale is number 10, and she was negative, and that's for suicidality.
Okay. And so why is it that you look at that one in particular, or why do you consider that most?
Because that shows significant depression, especially if they have thoughts of harming themselves.
Is it fair to say that that Edinburgh scale, it also could fluctuate with postpartum mom depending on their situation?
Yes.
And the other screens that you
Wait, this is the first time I think, so that yesterday would have been day 10. This is the first time the Commonwealth has deigned to admit the reality that mental illness, even if you are diagnosed, is not linear. It's going to fluctuate from day to day.
performed, did you identify whether there was any substance use issues?
No, there wasn't.
Now, once you were able to kind of gather all this information from her and do these screenings, were you able to come up with an assessment and a plan for how to help her?
Yes, she.
And what was going to be the plan with Miss Clancy?
So we had discussed starting Prozac.
Okay. And is that, or why Prozac? Why start there?
Because she'd had a history of being successful on it in the past. And that's a good indicator that instead of trialing multiple medications, to start with the ones that actually work. So I gave her 10 milligrams for the first 4 days to make sure there were no adverse reactions. And then I was going to increase her to 20 milligrams if she tolerated that well.
Okay. And what about some of the medications that she had already, that she was already on, the Ativan and Benadryl and the Trazodone? Did you have a plan for those?
I did. So I encouraged her to take the Ativan. So when Prozac can sometimes be very activating, it can make the anxiety worse before it gets better when you first start it. So I wanted to pair it with the Ativan just in the beginning, just to help her be more comfortable with the anxiety and to make sure that it didn't interfere with her sleep.
And as far as Prozac goes, what class of medication is it?
It's an SSRI, a selective serotonin reuptake inhibitor.
Is it commonly prescribed to treat people with depression?
Yes, it is a first-line treatment.
You said first-line treatment?
Correct.
And the idea of pairing a particular medication like an SSRI with another medication, is that a fairly common practice with psychiatric medications?
Yes.
As far as you mentioned that sometimes symptoms could get worse before they get better. Is that also common with SSRIs?
Yes, it is.
Does it take a while for a medication to get into a person's system and stabilize them?
Generally, side effects are the first week or two, but to get to a therapeutic level, it's about 4 to 6 weeks.
And was this something that you discussed with her about the timetable it would take to reach a therapeutic level?
Yes.
And when we say therapeutic level, what's the goal of reaching therapeutic level?
Is remission in symptoms.
People start to feel better then, right?
Correct.
Now, even though you were advising that she continue with the Ativan and she had told you that she had concerns about continuing with the benzodiazepine, did you indicate that there would be a plan to taper that or reduce that?
Yes, once the activating symptoms went away, then we would look at reducing that and moving away from the Ativan and moving more towards like a Buspar.
Okay. And as far as talking about that plan and what the risks and benefits of that plan were, did she appear to understand and engage in conversation with you about that?
Yes, she verbally understood and said that she understood the instructions.
Did she ask the appropriate questions or follow up?
Yes, she did.
And as far as kind of overall what the plan was moving forward, was medication the only recommendation that you were making, or did you have other recommendations for her?
No, I set her up with talk therapy with Letitia Dukes as well.
Sorry, when you say talk therapy, what do you mean by that?
So coming in and actually doing cognitive behavioral therapy with a clinician, someone who is trained in this.
And so you mentioned Letitia Dukes.
Correct. She was the clinician in our program at the time.
And when you make this recommendation and this intake visit, do you work with the patient to schedule something before they leave, or is it up to them to schedule the time with the social worker?
It was set up with her before she left, I believe.
And you're aware that the first scheduled appointment with Letitia was for December 2nd?
Correct. I believe because it was a holiday week that week.
Okay. Now, this time that you were with Ms. Clancy during this initial intake, fair to say it was approximately 60 minutes?
Yeah, she spent 30 minutes with my nurse and 60 minutes with myself.
So she was there for an hour and a half.
And let me just go back looking at notes I didn't take. The average the average appointment of Dr. Tufts was 30 minutes, divided between 15 minutes of talking at Lindsay, I think, and then 17 minutes of yay. I gave her hope and change. I told her there's hope and things will change. And I did that for 15 minutes, which, honestly is more than I could have tolerated, um, of her encouragement. I mean, that should be a punishment at Gitmo. You have to you have to sit and be encouraged and be offered emotional support by Jennifer Tufts. God, no! I'll confess! I'll confess! Have a great lunch, Wolfram. Thank you for being such a wonderful mod.
And is that normal time period that you allot for people coming in for intakes?
Yes.
And as far as follow up with you as a clinician and prescriber, was there a plan set for when she was going to return?
Yes, we had established a return in 2 weeks.
Now, at this point, because you had made that initial contact with her and you had done this intake, was she going to be assigned to you as a patient?
This was going to be a short-term arrangement. I was already in the process of leaving the program at the time.
Had that been communicated to her?
I don't recall.
Okay. And as far as what your plan was, how long were you remaining at the practice?
I was at the practice until mid-December.
So this was like a pre-planned.
I was moving back to New Hampshire, yes.
But as far as the preliminary care,
God's country, I would move to New Hampshire in a heartbeat. I've always wanted like a log cabin in the middle of the woods with a wood fireplace, and my neighbors to have the general New England disinclination to get into my business. I was like, I have constantly told Mr. Bow that I want to move to New Hampshire, and then I got hurt, and snow and cold and rain do not seem to be a part of my general life plan going forward. But I still want a cabin in New Hampshire.
you continue on with Lindsay as a patient?
No, I transferred her care on November 30th. And I communicated with that to Lindsay.
So as far as after the intake, she was provided with that December 2nd intake or meeting with Letitia Dukes, the social worker. And then the next scheduled event would have been December 7th, right? For a follow-up?
She had I believe, I don't recall what her next follow-up with me was. I don't recall that date, but she did have a follow-up with Rebecca Gelata.
Okay. Prior to you communicating on November 30th that you were transferring her care, did you have further contact with Lindsay Clancy?
Yeah, we had a few phone calls and my chart messages going back and forth.
Can you just explain to the jury what the MyChart messaging system is in your practice?
It's kind of a chat feature between the client. They can reach out directly to the provider. It goes right to our inbox and we can talk back and forth between visits.
And do you encourage patients when they come in that first meeting to utilize the MyChart messaging system?
I do. Often it's the quickest way to get a hold of me if they're experiencing any major issues.
And fair to say it's just an easy way in between visits to communicate particular points of information or concerns or symptoms?
Yes.
Do you in your practice often use MyChart messages if you're not available to meet with the patient to make changes to their treatment plan?
Occasionally, yes.
Now, prior to your first MyChart message with Lindsay Clancy, did you get a text message from her on your personal phone?
I don't recall.
Do you recall whether Sue Clancy provided your number to Lindsay?
I know I did. So she had my number because I called her from my personal phone call because it was on a Sunday when I reached out to her initially.
So that November 20th phone conversation was a communication between you and her on your personal phone?
Correct.
And so do you recall on November 22nd getting a message from her saying, "Hi, Julie, this is Lindsay Clancy. I'm sorry to contact you like this, but when you have a minute, can you please call?"
I can't recall whether that was a MyChart message or if that was on my personal phone. I apologize.
That's okay. As a result of some way her contacting.
I do believe that this will be brought out in cross or somewhere in here. But this particular clinician was giving out her personal number if her clients, if these women, were having, extreme struggles outside the hours of clinic, if they were having a big issue, if they were worried, if they were scared. I do think it comes out in testimony that she did give out her private number so that, if they were really struggling, if they needed to know, "Should I go to the ER?" "I feel like I'm in crisis. Should I?" Um, and again, it's so heartbreaking, the level of care that this woman gives her clients versus Jennifer Tufts.
Did you then have or send her a message or have a conversation with her on November 23rd?
I know we communicated on the 22nd. I sent a message saying that was the day she was getting nervous about starting the Prozac, so we encouraged her to go ahead and start the Prozac. I know we communicated on the 23rd, either by phone or by my chart message, that indicated that she had taken the medication. She had started it on the 22nd.
Okay. And were you aware at this time period that she was currently already a patient in the South Shore Health System Network with a primary care physician named Margaret Anastasia?
Yes.
And she's a nurse practitioner, right?
Correct.
Now, as far as these concerns that she relayed to you about starting the Prozac, do you know whether she did start the Prozac?
Yes, she stated that she started the Prozac on the 22nd of November.
Okay. And by November 25th of 2022, did you start having some MyChart communications with Lindsay Clancy?
I did.
And so just referring first to November 25th of 2022, fair to say that you gave her or sent her a MyChart message encouraging to kind of stick with the plan, right?
Correct. Prior to that, yes.
At that point, had you prescribed her something to help her sleep outside what you had previously provided or outside what she had?
Before November 25th, I did not.
Okay, so on November 25th, did you prescribe her some additional medications?
I did. So she wasn't tolerating the Prozac, so we had a conversation about stopping the Prozac. I gave her, she was really having a hard time sleeping, so I gave her a one-time dose of Ambien. And then I also prescribed mirtazapine, which is another antidepressant, but it works really good for sedation and anxiety. So it started that at 7.5 milligrams, told her to stop the Prozac. And I also paired it with Klonopin, but I told her explicitly not to take the Ativan, just to take the Klonopin to help. It's longer acting benzodiazepine to help her with sleep and longer acting anxiety support while we got this new medication up and running.
And so in your conversations with her about her concerns about the Prozac, fair to say she reported to you that she was feeling disconnected, out of it, a little bit spacey. Does that sound right?
Yes, that's correct.
And so you said your recommendation at that point was to discontinue the Prozac.
Correct.
Not increase it or double it, not claiming that you didn't assess Lindsay as not being in touch with her emotional state and blaming everything on the meds. How interesting. How very interesting. Because we were told by an expert. I mean, she has a special interest in pregnant women, according to her. Advertised as expertise by the marketing department. And she told us that Lindsay was not able to fully assess her mental health state and that she, in fact, was blaming the medication. You say you work in the same field? Interesting. Also, Ambien is not without a lot of severe and very scary side effects. I mean, some of them are kind of funny, like night or sleep gambling, but these are, you are doing acts when you are not conscious or not conscious. And these are incredibly powerful drugs. Yes, they do work effectively when they work without side effects, but the side effects can be just as strong in these powerful drugs as the benefits.
And as far as the Prozac went, she hadn't taken it for very long, had she?
She took it for 3 days.
3 days?
Correct.
And again, you had that conversation with her about kind of waiting it out for the 4 to 6 weeks.
Or maybe she was a mom who was terrified that she started to feel disconnected within 3 days of taking a medication, and for the safety of her children said, "Please, I feel disconnected within 3 days. I don't want to deal with 3 weeks of disconnection before I could potentially start to feel better. I am terrified of the disconnect I feel in these 3 days.
But based on what she was reporting to you, did you have any concerns about her stopping the Prozac after only 3 days?
When a client doesn't have buy-in to the medication, it's awful. It doesn't work as well. So I was working with Lindsay to try and find a medication that would make her feel more comfortable. She was feeling very uncomfortable, very anxious, and the Prozac, she just wasn't tolerating the activation from the Prozac. So mirtazapine is a little bit more calming, which I thought she would resonate with better.
Okay. And so again, this is not one of those follow-up visits on a telehealth or a face-to-face. So were you relying heavily on what she was reporting to you?
Yes.
And again, in that MyChart message, you did indicate to stop the Prozac, Benadryl, and Ativan, and don't take while taking Klonopin, right?
Correct.
And in your practice as a psychiatric nurse practitioner who prescribes medication, is it common that you have to kind of trial different medications to find the right one to work for any given patient?
Yes, it's pretty common practice in psychiatry.
And fair to say, there's no way to anticipate how a particular patient is going to respond to any particular treatment, medication treatment.
Correct.
So after prescribing the Klonopin, the mirtazapine, and giving her that single dose of Ambien, did you do anything or set anything up to follow up with her after changing those prescriptions?
I just told her she can MyChart message me over the weekend. It was the holiday weekend. So I made sure she knew I was available to answer her questions.
And fair to say she did, in fact, you sent you MyChart messages over the course of that weekend, correct?
She did, yes.
And so starting at 7:51 on November 26th, she reported to you kind of how that night went, didn't she?
Yes.
Where she said, I did better last night. I took 7.5 mirtazapine and 0.5 Klonopin at bedtime, slept fairly well on and off until 3:45. And then she asked, do you think increasing the mirtazapine will help me stay asleep longer? I can survive like this, but would be helpful to get to sleep until at least 5. Thoughts? Thank you, Lindsay.
Yes.
Did you respond to that message?
I did.
And what did you advise her to do when she asked about increasing the mirtazapine and wanting to stay asleep longer?
I said she could trial the 15 milligrams.
And again, is that something that is common for you to do in prescribing, that maybe you have to adjust the dosage?
Yes.
Did you have any concerns that increasing the mirtazapine up to 15 would have had any issues or problems?
No.
And then again, on November 27th, you had a correspondence with her starting at 9:59 a.m., where she again reports to you how she did that night. Is that something you encourage her to do, to just give you a nightly or like a follow-up the next day, check in to let you know how she was or what she was experiencing by way of symptoms?
I do that with a lot of clients that are really anxious. I like to make myself available to them so that they have that reassurance.
Okay. So this wasn't.
God bless this woman. God bless this woman for reaching out and being a safe place for moms, especially anxious moms, especially, when the entire world has told you you're high strung or you're overthinking this or just relax. The fact that she is willing to give up her free time to help these moms feel okay. Gosh, I wish every clinician was like her.
Kind of unexpected.
It wasn't out of the ordinary for me.
And so on the 27th, she indicated she slept well, taking the 15 of mirtazapine and the 0.5 Klonopin, feel rested but super disconnected with myself and reality, and describes it as a scary feeling, thinking of stopping Klonopin tonight and just taking the mirtazapine. Do you recall that communication? And she acknowledges that I've only taken it 2 nights, so that should be right, okay? Or sorry, I've only taken it 2 nights, so that should be okay, right? Do you recall her asking that?
She's referring to the Klonopin, and yes, she did. She was really anxious about being dependent on benzodiazepines. So I think her goal was to not be on them. And if she was going to, the disorientation might have been because of all the sedation from the mirtazapine, which is a common side effect, which is why we chose that. And she knew that. And adding the Klonopin, maybe removing that might have helped with some of the sedative factors for it.
So did you find that there to be any issues with stopping the Klonopin or her deciding not to take it after 2 days?
No, I did not.
And in fact, you indicated and told her that should help with the disorientation, right?
Yes, it might.
Okay. And so that was on November 27th. And fair to say that there was another communication via MyChart on November 28th with Lindsay Clancy.
Yes, there was.
And at this point, she was asking for, or there was some back and forth about needing a note for work, correct?
Correct.
And is that something that you had talked about with her about getting another note for work?
Yes, that's what I do that often.
And in fact, you kind of went back and forth with her, and ultimately she said never mind, that she didn't qualify for short-term disability anymore, and she's just going to be on personal leave.
Correct.
So on the 28th, there was no back and forth about her taking the medicine and the effects or how she was feeling?
She actually had a panic attack earlier in the day before there was communications about work. And I recommended she take 0.5 of Ativan and go for a run. And I also recommended that she consider doing the partial hospitalization program at women and infants.
And what was her response to the recommendation for the partial hospitalization program?
At that time, she felt it wasn't going to work logistically for her or her family.
Okay. And why did you recommend maybe going for a run?
To get rid of some of the adrenaline from the anxiety. And running has been a really good thing for her in the past, and I thought it would help calm her down.
Now on November 29th of 2022, that was the first day that she actually met with Rebecca Gelada, but you had some conversation with her, or she sent you a message, I should say, earlier in the day, correct?
She sent me a message earlier in the day, and at that time I wasn't working that day, and Rebecca had an opening, so I offered the appointment with Rebecca for her. So I didn't actually communicate with her that day.
Okay, but you did receive her message at 6:05 a.m. Where she reported that at that point she took 15 Remeron and CBD, and it only worked slightly.
Correct.
So how did you get from what you have told us now was the mirtazapine, or that's Remeron, right?
Correct.
How do we get from just the mirtazapine with not the other, without the Klonopin or without some other?
The Klonopin was an as-needed medication, so I honored her choice to be able to decide whether she wanted to take that or not.
Okay, so after this panic attack, after the
Holy crap. A psychiatrist who listened and clocked the patient's discomfort with benzodiazepines and realized that her innate fear of them might be increasing the anxiety. So, tries to find medications that will help her sleep. Restorative sleep. I cannot tell you how, when I get a lucky night where I don't wake up, several times readjusting or in pain, um, it's so much different in how I can engage with the world, ba rather than this sort of disjointed and not so restful sleep that I normally get. And it's such a big part of a healthy body and a healthy psyche that the way the Commonwealth is downplaying it, I don't think, is going to fly given the well-documented, physiological and psychological effects of lack of sleep.
communication about the work form, she reports the next morning that she took the 15 of the mirtazapine or Remeron, and then she was having some sleep issues, right?
Correct.
And that she tried breathing meditation and muscle relaxation, but that she ended up having to take that Ativan.
Correct.
Now, had you had any conversation with her in this back and forth in these MyChart messages about whether Ativan was something that she should continue to take?
It was understood that she wouldn't take it until I had that conversation with her. I was under this understanding that she wouldn't be taking it while taking the Klonopin.
But she had told you she wanted to discontinue the Klonopin.
Correct.
And so you said as of November 30th that you had then fully transferred care.
I let her know that I would be leaving the clinic, and I thought it would be best if she saw a clinician that was working 5 days a week.
And Rebecca Delata, is she a clinician that works at the clinic?
Correct.
And had you worked with her for quite some time?
She had been in the clinic, I think, for 2 years, I believe, at the time.
And you said that you had recommended on the day before, on the 29th, that she set up that meeting with Rebecca because she was available.
Correct.
So it just was kind of happenstance that she ended up with Rebecca, or?
I was in the process of transferring all of my patients between Rebecca and our new hire, and Rebecca was an experienced clinician, so I felt she'd be a better match for Lindsay.
Okay. And as far as when you sent or communicated to Ms. Clancy that you were transferring her care, that was via MyChart message, right?
Correct.
And Lindsay then responded to you, or do you recall if she responded to you? I'm sorry.
She did respond to me saying, thank you for the care that I provided. She appreciated it and wished me luck.
Did you have any other contact with Lindsay Clancy after that point?
No, I did not.
And just to be clear, so when we were talking about moving from November 28th to the 29th in time, did you have a phone call with her outside the MyChart messages about that panic attack? Or do you recall having entering a progress note about that?
I do remember entering a progress note about that. And that's when I told her to go for the run. I made the recommendation for the PHP.
Did you ever have any further contact with Sue Clancy about Lindsay Clancy's care after that first contact on November 20th, 2022?
I don't recall that.
I have no further questions at this time.
Council, can I see it? Sidebar.
I don't know what the point is with this woman, although of the 973 state theories, I think she is put up here to show that Lindsay is neurotic and not listening to medication, or maybe she's overly sensitive and blaming the medications, bolstering Tufts kind of interpretation of Lindsay. Maybe they just want to bring up the fact that she had a CBD gummy again. The voices from the bow told her to do it. Logistically, it could be anything at this point. Now we are getting into current day. Now let's see if it will actually do this without popping all the way back to the start. We are going to get into the motion about the particular woman who has been all over X. Now, she was a former employee of the Milan inpatient clinic, and while she was not employed at the time that Lindsay Clancy was inpatient, she had been an employee at that particular mental health care facility in the year prior, and she has been all over X, kind of giving her the behind the scenes of what the skeleton crew and what reality looks like on holiday times, or very, very skeleton, decreased staffing looks, and the reality of the care that Lindsay probably got while she was in a quote unquote inpatient facility.
Well, before we get going, I just kind of wanted to remind everybody that there is a media order that has been issued on this case. And for some of the media and the individuals who've been here for the last couple of weeks, I'm sure are familiar with it, but I know there's a constant people coming in and out. So I just want to remind everyone that there is a specific media order that's been issued on this case, and everybody is presumed to have reviewed it and agreed to it. So if there are any violations or problems with that, we'll have to deal with it. But I just kind of wanted to remind everybody, especially people who may have just come into the courtroom recently. So if you have any questions about what that order is, you can speak to any of the court officers. They have a copy of it. We can get a copy of it to everybody who needs to see it and review it. All right. And with that, what we'll do is we're going to go, the defendant, had filed a motion for addition to the witness list, to add to the witness list regarding Ms. Thorndike. So what I'm going to do first, I'll hear from the defendant, then I'll hear from the Commonwealth. Mr. Reddington.
Thank you. Your Honor, basically, as the motion speaks for itself, there is a woman, her name is Emily Thorndike, who's a LACSW here in Massachusetts. She owns and is an independent operator of her own clinical social work establishment called Wise Mind Therapy. Your Honor has her resume. She graduated from Dover Sherburne High School, received a Bachelor of Arts in Sociology from Hartwick College, master's degree from BC, 2019, is licensed in Massachusetts. And interestingly enough, she did work at the McLean Hospital in the very short-term unit that the doctor was testifying that Lindsay was in for 5 days in January of 22 into 23. She worked for 5 years as a mental health specialist from May of 2014 to May of 2019. She was a clinical social worker manager of that unit from 2019, 2021. So she's basically got about 7 years and 7 months of experience working in that unit for a majority of that period of time, full-time employee, and then for 1 year as a supervisor. She left, as the court is aware from the motion. I vetted her out. I obviously would be concerned if there's any so-called axe to grind, if you will, any lawsuits pending. Were you fired? Did you have any difficulties? Any claims for harassment, hostile workplace? Absolutely nothing. She has friends that are still employees that still work at McLean. And I do not know this woman. I have literally never met her. Her involvement in this case came about after one of the prosecutors, I don't recall which, made it out on direct examination that McLean is some kind of a five-star institution where the doctors, the psychiatrists, the psychotherapists.
Okay, can we talk about this? What in the unmitigated fashion hate crime is this? Now, I'm not telling you that I'm a parapsychologist, but I'm an unlicensed one in the Eastern Seaboard. And I can tell you right now that whatever demonically possessed Annabelle doll you took that off of, they're gonna wreck your home, and all of your precious moments dolls will be smashed on the floor. Trunchbull, you done picked evil. What in I am a 5-year-old and I need Garanimal. Y'all, you need to get the full effect of this ridiculous. What is this? Again, I am not one of the Warrens, but I'm telling you, whatever demonic doll you done stole that from, they are wrecking all of your precious moments, tchotchkes. Don't say I didn't warn you. You're going to need a young priest, an old priest, and a Unitarian. You're going to need a super soaker full of holy water. And have you ever happened to see Killer Clowns from Outer Space? Because you're going to need that kind of knowledge.
The counselors were all banging into each other in the hallway, trying to interview Ms. Clancy, who was just blithely refusing care and treatment, which is not the case. Patrick testified as to his observations. The court is aware that Patrick's testimony clearly, in all fours, landed on the fact that it was clear to him that there was no staff that was available other than kids behind plexiglass on their cell phones. She colored. She took walks. There was no therapy. She didn't speak to any therapists or counselors. So now the jury is left with that image that McLean is purportedly some kind of a five-star hospital because they're affiliated, quote unquote, with Harvard, which you, from your practice, I'm sure, as I know from my practice, is far from the truth as can be possible, in my opinion. But it doesn't matter what my opinion is.
Snipe Hunter, that is one of the SSRIs that were tried on me. I honestly feel like I don't know if my doctors took it as a challenge when I would just bold-faced tell them, "Look, I'm not telling you how to do your job, but I've been on every SSRI. They do not affect me." They'd be like, "Well, this is a new one." And I'm like, "Okay." Uh, Basically, I didn't have any effects, of them, but, what I have heard from people that, do find, relief with Wellbutrin is it's not as nasty as, say, the Prozac or, kind of some of the older school ones, and it does help with I know it's prescribed a lot if you're trying to quit smoking, so, I'm not a pharmacologist, and every single person's internal chemistry is gonna be different, but from the people that it does work for, I've heard that the side effects are milder. Whatever that means.
As I could cross-examine somebody till the cows come home, it doesn't matter. This woman posted a video on TikTok, which, much like yourself, I'm sure, I hardly know what TikTok is, but I received an email from one of the very, very active people in the community of TikTok saying, "Look, you got to check this video out." So I did. This is about a week ago, maybe longer now. When I saw her video saying that she could not stand for, and I quote, "the lies and the misrepresentations from that witness stand about McLean Hospital," I then said to my private investigator, Bob Jones, I said, "Bob, I can't find this woman," because she had a pseudonym name or whatever. He went, we wrote, he called her, left messages. She never got back to us for like 3 days. He went to her house. He sat out in front of her driveway. She came home from work. They interacted. He waved, didn't want to scare her. And she said, I thought, and oh, by the way, I believe that my wife had written her a letter as well, because she's a nurse and was trying to reach out to her to have her get in touch with me, to no response. She then tells Bob, "I thought you guys were all AI. I didn't know that you were real. I thought it was spam." He then gave me her number. I spoke to her. She told me exactly what I put in the affidavit or in the motion, and she is available, ready, willing, and able to testify to an employee's observations over 7 years, including as a supervisor, as to what woeful environment McLean Hospital offers, especially on holidays, such as major holidays like New Year's, which is fine. We all enjoy New Year's. But nevertheless, New Year's, the day after, that weekend, Monday, nobody was there. And I think it's important to rebut the inference that was created through the examination by the DA.
All right, Mr. Brake, let me ask you this, and I'm going to ask the Commonwealth kind of the same thing. What's the relevance? What's the argument for the relevance of what McLean's was, at least because she wasn't there for about a year, if I looked at the motion. Is that correct? Oh, that's all right.
Yeah, that's true. She left. She has her own business now, and she left, but it was just a year.
Yeah.
There's no change in the circumstances from Lindsay going into that hospital on New Year's of 2022 to 23, and this woman's work experience where she left a year before. And I agree with you. This would have been a non-issue were it not for the flavor of the government's repeated argument that she was a person who was spurning healthcare, didn't want healthcare, had the opportunity, and she walked away from the opportunity, which, as I say, is as far from the truth as possible. So I think it is now, because of their questioning, squarely before the jury, to leave that impression. And the woman that was the doctor from McLean was just a pleasure. She was just a lovely, lovely woman and testified as best she could in the case. But they're left with the impression that McLean is this wonderful place that she just did not have any interest in utilizing what was available to her. That was not available to her. And she's testifying to custom, practice, and her observations over 7.5 years.
Is there another alternative to get there? Someone who actually works there or worked there during this time period? That it's the time period that
a year.
One of the things that, well, yeah, but things can change in a year. You know?
I don't think so.
No, don't fight. You two are brochachos. I need you to do that like oily hand slap thing that they do at in Predator. Somehow in my mind all male problems are solved. Look, little young Mo thought that all male problems were solved by the sweaty, arm grab. I've learned that male psyches are a little more complex, but I definitely thought I'd always wished to be a boy because I figured I could just go up and like high five boys and I would suddenly know how to like boy.
But McLean,
I don't know so. I guess that's the question. I don't know so. That would be that's one of the things I may have to wrestle with, but that's kind of what I was asking, whether or not there is or I understand the argument.
And I very much like that the judge is sitting here and being thoughtful, as much as I very much agree with the reasoning that Reddington has laid out. He does also have to be a fair a fair goalie. So, this is a kind of surprise witness, and I'm sure the Commonwealth is going to have something to bloviate about.
Okay. And I understand the argument regarding relevance, but if we're talking about staffing or the availability of programs and how that work, this witness is a gap there. I guess that's all. I'm wondering if there's another way to get there.
So, the realities of trial practice, if you're the government, you send summonses, you have people come to your office, you're interviewing witnesses. If you're the defense, they run for the hills. For example, one motion I'm bringing with you is merely looking for pediatric records that I have.
Now, Sebastian, I was only ever tangential in the Karen Reed sort of universe that has now become a multiverse with like its own multiverse. I think that if I've picked up sort of information from X being what it is, so take this with a pound of salt, I don't believe that he was on the Free Karen Reed side from the beginning. I think once the evidence or lack thereof, I don't know that he ever came out publicly, but I don't think he was a big Free Karen Reed vocal supporter. Now, it does seem like he has a working relationship with Attorney Yannetti, but I don't know any of that. I would recommend, asking Baker or, Aiden, people that are much more kind of tapped into the turtle world. I tend to, kind of pop into, like, different worlds and kind of visit, but never, really kinda stay and know all the background deets. So, I would recommend those 2. Um, uh And I know there's a bunch of other good content creators over there. I don't know enough about the ecosphere to give you any more recommendations than those 2 as far as where to get more information possibly. And the Glarer. The Glarer's good. The other Mary B, basically anyone you saw at Dollywood who is in the turtle sphere will probably know more than I am. I do.
Had to have Bob Jones go and try to get them HIPAA forms, everything, and they're avoiding us horribly. And I'm going to have a contempt hearing request very shortly. But the point I'm getting at is, if they want to,
Okay, I don't know who the okay, someone needs to have public relations training. Someone needs to I don't know who needs to have media training, but I need you
had
to
to have
look
Bob
at
Jones
these
go and try
2
to get them HIPAA forms, everything, and
heffalumpulas.
they're avoiding us horribly. And I'm going to have a contempt hearing request very shortly. But the point I'm getting at is,
Again, you are on camera. I need you to understand when you are in a courtroom, everything you do is being observed by some weirdo like me, who notices all the things, okay? So you have to be aware that your snarky, smarmy little attitude, your contempt, is gonna get captured and it's gonna get noticed. And again, I congratulate you in your valiant ability to wake up every day with ever mounting scorn upon your performance and your professional conduct, and still manage to maintain the same level of smarmy, unearned moral superiority. I don't know how you do it every day. I mean, I just put my bra on one boob at a time like a normal person, so, um if you could give me a way to, go out into the world with all the unearned overconfidence that you managed to do wearing that bow, I would be unstoppable. See, God gives me a poor ego to keep me in check. Otherwise, I would be a female Darth Vader with great hair.
if they want to reach out to McLean, I'm sure that McLean administration would bend over backwards to give them every record that they would need as to how many employees they had, what their work records were, their doctors, their counselors, all available. I know I can't get it. So I'm suggesting to Your Honor that this is an opportunity for a person who worked there for all those years, who does not have any dog in the fight, to testify to what her observations were clearly within her time frame. She left a year before Lindsay went in there on New Year's. So I certainly agree with that. Cross-examination, they could get records if they wish, but I think it is relevant.
I prefer to think of myself as a Mace Windu. I have a purple lightsaber, which means that I wanna say Chikari Trist look, it's some kind of crystal. Basically, it got tortured just a little bit, not enough to go full red, but it has felt some pain. I've always aligned myself with more of the gray Jedi, who believed that, um, you're more a good person and to, deny all feelings was dumb. We were a small heretical group that got, run out, but we were actually the logical smart ones, and we didn't end up trying to make out with our sister, so, it is what it is, but history will prove us right. Am I right?
I think it's material, and I think it has to be used to rebut the inference that was raised.
All right, thank you.
Thank you, Judge.
Yeah, Commonwealth?
Your Honor, the Commonwealth would object to the witness, the late disclosed witness, in addition to the obvious Rule 14 issues, the fact that we didn't have notice of this individual, there's been no discovery other than what's contained in the affidavit,
Blah, 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 blah. Let's listen to the judge
and
talk.
offer this subsequent witness and call it a rebuttal witness. It's not a fair line of examination. It's not a fair line of rebuttal where she wasn't there during the time period. So we would object for all of those reasons.
I mean, just so everybody knows where we're going. I can't imagine that witness would be allowed to give her, in a sense, review of McLean's. If it's 5-star and she may say it's 2-star, this is not TripAdvisor. I wouldn't allow that.
And no one,
But the question seems.
Let the judge speak. Let Phil Donahue Springer hyphenated, not blended. Let him speak.
To be, for me, a closer call about what the standard staffing and programs may be available on a holiday weekend. Because the Commonwealth's witness said, I don't know that. And that seems to be something.
Denise, that is more offensive to me. That is so much more offensive to me that she is wearing the bow because Cora liked it rather than putting on a competent, well-researched, well-constructed case. The fact that, again, she's using this as a prop to, honor a child when she didn't put the basic effort in to put in, any effort to construct a logical, motive, not 73,000 different theories, have competent witnesses, stipulate, all of these things that she could have done to show honor, dignity, and respect. They could have stipulated to so much so pictures and extra photographs of the children wouldn't be out for public consumption. No, they put them right out there. They essentially emotionally waterboarded Patrick Clancy for 3 hours. So no, I find it incredibly crass that you are going to put on a prop. And that's all it is to her. If it were a deeply held honor, then you would put a small bow pin in your jacket, because you wouldn't need a giant public display to show that you are honoring this case, because you would be handling it with dignity and care.
That maybe the parties could come to an agreement about establishing either, there's got to be somebody who's still working there that says the weekend, 2 weeks, the weekend after this wasn't a holiday, we have X amount of people there. We have X amount of programs that are available. On the holiday weekend, we do or we don't. To me, that's where the battle on this motion is. I do understand the Commonwealth's objections regarding allowing people who watch the trial to then say, I disagree with it and I want to testify about what I disagree with. That's troubling, but I'm talking about the facts on this thing. And that's if it was anything other than those kind of facts and this witness had not worked there, I'm not sure we'd even be having this hearing.
And I would suggest that counsel indicated that in trial practice that people are reluctant to give information to the defense. But there are procedural avenues that he could pursue to get that information involving the court. There's been no indication that he's actually tried to do. And again, I would suggest to the court that we have the McLean records from that time period in evidence, and they are the best evidence of the contact that people there, staff that were there that day, had, or those 4 days, had with the defendant on that day. So from the perspective of if there's missing information, there are avenues he could pursue if he wants to rebut it. I would suggest that this person's testimony is not relevant because they weren't there. And I would agree that the better option if defense wants to present this as a rebuttal would be from somebody that is there, but he doesn't have that. And so for those reasons, this motion should be denied.
And you don't have to commit to this at all, but it seems to me that it would be a very simple solution to get the staffing records or somebody at McLean's who can testify to this. What was the program availability on mid-December weekend, if you went in there, as opposed to the weekend of New Year's? And it may be no different whatsoever, and that kind of eliminates the argument. So I think probably the best way to deal with this is to maybe have a voir dire of this witness. Regards to what, so then the record's clear too. But it also allows the parties to consider while we're setting this up, maybe there's another way to do it, a lesser alternative, so to speak, that would reduce the prejudice to both parties. So
Again, I don't know how a voir dire of this particular witness, who clearly wasn't there and didn't have contact with the facility during that time period, would answer Your Honor's questions.
Well,
But I do agree.
Maybe we can find out. I can ask the questions and we could see. I understand.
Voir dire.
The problem that I kind of had as the case was going, the individual that was probably, you would anticipate, could talk about the staffing, the difference of a holiday weekend and a non-holiday weekend, said she wasn't aware of that. So,
Well, I don't know that she said she wasn't aware of the difference. She said she wasn't aware of who was there on that weekend because she wasn't working that weekend. So I think there's a slight distinction in that. But again, the witness was available. Counsel could have crossed her on that, subject to any sort of objection, and we could have addressed it at that time when the witness was on the stand. But again, that witness is under summons, and if counsel wants to recall her, he can. There are avenues that he could pursue.
How would she opine as to the staffing characteristics of a wing at which she is just a sort of consulting psychiatrist? She is in no way involved in scheduling. She would be in no way involved in the minutia of how many staff, what's protocol, what's risk management, what are the state guidelines. She would have absolutely no idea what those parameters would be. So why would the defense call back that particular witness who you already stated in your soliloquy wasn't there, therefore is useless as a witness trying to, ascertain?
If he wants to pursue this line of rebuttal, that's short of calling this particular witness that's been proposed, is the point that the Commonwealth wishes to express.
So I'm going to take this under advisement. I want to review it. But I'm inclined, just so everybody can kind of maybe make some idea where we may go with this, I'm inclined to have a voir dire. This witness or some other witness. So maybe the defendant can get somebody who hasn't watched the trial, because I do understand there's an issue regarding sequestration, but that may be a function of a trial like this that's being broadcast. How do we guard against that? But that affect really the relevance, the prejudice, the determinations I have to make, really under all the rules, 401, 403, all of those considerations that I have to make. So I'm inclined to do that unless the parties can think of I won't say better alternative, that's not fair to this witness, a different alternative that might address everybody.
We're going to be able to agree on anything, Judge, so it would really be up
to I know, but
the referee to make a decision.
Right. What I'm trying to do is put that out there. If the
tend to put upon oldest child, look, mom, I have tried to be nice to him. He's a pain. No, every time I try to be nice to him, he annoys me and I end up mad at him. Why do I have to be his best friend? And mom over here, I made you two best friends for each other. You will be friends. And, Reddington's me over here, the realistic firstborn. We have very disparate personalities. They will not deign to allow me or give me any help. I think we have seen indica of the fact that they do not want to cooperate with me throughout the entirety of these past 11 days. If you could possibly just step in and make a ruling, because these heifers aren't going to get off of their high horse, decrepit and broken as it is, to help me.
Parties can agree. I think the three of you know me. I don't have a problem making a decision. I really don't. But I just kind of wanted to give everybody that opportunity to maybe craft a solution. And if I have to do it, that's kind of what I'm saying by saying I'm taking it under advisement. So I'll let the parties know.
I may just ask,
Sure.
Your Honor, if you're reviewing this, taking it under advisement, that you do look in more detail at those records, the McLean Hospital.
Sure,
records,
yeah.
The records that prove that she wasn't seen by an acting or clinical professional until 3 days in, and that professional gave her a website. Do you really want the judge interrogating the records that much? Now, far be it from me to, stop an opponent as they continue to sideshow Bob into rakes, but, what planet are you from? I need you to look at the records that are being used as potential malpractice and negligence in order to prove that, there was a skeleton crew. I mean, okay.
current evidence so that Your Honor can see the extent of the contact, the extent of the notes of people who actually dealt with her. Because again, that is the issue. That is the factual issue here, is the contact that she actually had. Not what maybe she wasn't offered at other points, but what she had while she was there. So I ask that you just
All right, I'll review that. I'll review my notes regarding the doctor who testified from McLean's, and then we can deal with this. This would be a witness that would be called later in the trial anyway, so it'll give me a chance to do that, review that, get a decision to the three of you, and then we can, depending what happens, either schedule a voir dire or go from there. All right? But all right, thank you for everybody for kind of agreeing to argue this a little bit earlier, so it gives me a chance to review the.
Yeah, Michael Osbrook, I think I have been very transparent in the fact that I don't know what justice looks like in this trial. I don't know if it looks like the civil case going through and the medical professionals who provided substandard care are held accountable. I don't know if Lindsay goes to a mental health hospital, if she goes to jail. I don't know. But the way this case is being presented as first-degree premeditated homicide strikes me as the same pitfall that the Casey Anthony attorneys kind of fell into. There is an incredibly high standard. They have to prove that Lindsay was premeditating this, and all they have thus far to prove that this was premeditated was a website that in further examination turned out to be Patrick Clancy looking up a I think performer who had unfortunately dealt or had passed away by his own hand. So it is baffling. Had the Commonwealth come up with this, there were missteps, but at the end of the day, Lindsay Clancy was able to, send her husband away and create an opportunity where she knew she was losing touch with reality. And instead of saying something to anyone, she sent her husband away. Now, is that reckless? Is that manslaughter? I don't know. I'm not a lawyer, and I don't know the intricacies enough to tell you what I would charge. But I do believe that there has been a fundamental misstep in the way that this trial is being presented, and it wouldn't have taken much to present this with compassion, but deeply interrogate whether Lindsay was, partially, fully, what level of responsibility and culpability does she have? There are so many things that could have been stipulated. This could have been just a trial of the experts. The experts go up, we present our experts' theories, we present the facts from the case that we believe strongly represent what those experts said, and then we let the jury decide. But instead, it has become nothing. Nothing but it feels like prolonged emotional torture and the state basically proving that Lindsay did not have adequate care, that she was given, telehealth visits where you didn't ever see her hands. Now, I made this point yesterday that typically this is what you're going to see at a telehealth. Now, if you're dealing with a boomer or someone tech illiterate, this is what you're going to see. But this is about the extent to what you will see if you're on telehealth. Now, when I am nervous, my leg tends to twitch. I tend to bounce my leg. I tend to do something with my hands. My hands are always moving. But if you were just seeing this, you wouldn't know that I'm showing other, visual signs of anxiety that might not be, again, reflected on my face. So so it's again, as I say all of this, I wanna be very careful because I know mental health care looks different, and what works for one person is not going to work for everyone. And if you get relief, if you have found someone and a way to talk and someone to talk to that fits you in telehealth, then by no means am I saying that telehealth is terrible. I think that for certain people, it is a very valid way to receive mental health care, help in an environment that is helpful for them. But I'll tell you as a award-winning masker, um, I need someone that can observe me. My body is going to tell you that I am anxious even if I am not aware of it. Uh, and and I'm not the best. So I have tried telehealth, mental health and different things in the past, and I've just not found it to be a place where I can make connections. But I think there needs to be respect and understanding that just because or just like there are different, learning styles, audio, visual, tactile, there's one learning style where you kind of just put everything together in your brain, and then the answer kinda just pops out, but if you were asked how it came to be, how you got from A to B, not a clue. I don't remember the exact name of that one, but that was an interesting one. I wish there was an understanding that mental health, medical health is not going to be a one size fits all. And for a great deal of our existence, the kind of amalgamated one size fits all medicine was good enough. But we now live in a world that full of constant stressors, 24-hour news cycles, and many things that the human body and mind, I just don't think were particularly, made to handle the constant stimulation. So, it's not shocking to me that we're experiencing more anxiety, more mental health issues, and I think there can be a respect and, a reforming of mental health to understand that um, there can be different more options is good, but the options aren't going to be right for everyone, and it's up to a clinician and, the patient being as honest as they can, to say, "Hey, I'd love to do telehealth. It would keep me from going into any of my issues that I'm really here to address," which is kind of my baseline. I don't like feelings. They take too much energy, leave, and they don't ever have a logic behind them. Um, so I'm not dogging every clinician. I am not demonizing every medication. What I am saying is that these are big, complex things that need to be handled with respect, and what we have currently isn't working. So let's get everyone to the table and figure this out. This is where I would go full Darth Vader, like, not gonna lie, Anakin kind of was speaking my soul when Padme was like, "Well, what if the Senate just" sorry. They were on that, water planet, and she's like, "But Anakin, what if the Senate doesn't agree?" And he's like, "Well, then I'll make them agree. I'll make them stay in Senate until they come to an idea and agree, for gosh sakes." And she's like, "But Anakin, that's not how diplomacy works." And he's like, "It is how it works, to me." And I was like, "Oh my god, I am Darth Vader." Um and ever since then, I have realized I should not be in charge of anything, because, well, like I said, I realized that I would wanna dominate until people made sense to me, and, people are never gonna make sense. We are gloriously absurd creatures. On that note, I am going to send you over to, Defense Diaries. I do have, a bunch of appointments, the rest of the day, but I want to come back and finish or at least catch up more on today, but we are looking at some pretty heavy storms coming through the Midwest. So do be aware of the weather when you're out and about or, watching coverage today because there is a potentiality for some really strong storms. Ryan Hall, Max Velocity, Brian Kopic. I think all of the sort of storm people are out and about today. So do be aware if of your surroundings and, a safe place to go if you're in the Midwest or in the affected areas. I am sending you guys over to Defense Diaries. Give them a hello from me, and uh, I will see you guys in the morning if, the power goes out. We live out in the boonies, so it's very, very likely the power's gonna go out. So be safe, be careful, and I will be here in the morning, if not this afternoon. Bye, you guys.